Neuromodulation is sort of a description of a broad series of techniques that use electrical energy or electrical stimulation or chemical stimulation in order to sort of get information into the body, into the peripheral nervous system, and then into the central nervous system, where it can act to counteract pain signaling. Some common technologies that I think people are familiar with are things such as spinal cord stimulation, TDCS, or transcutaneous direct current stimulation, TMS, transcranial magnetic stimulation, and VNS, or vagus nerve stimulation, and its kind of non-invasive cousin, transcutaneous vagus nerve stimulation. The mechanism of action is still, I think, a very open topic for debate. We know, for example, with TMS, transcranial magnetic stimulation, that you are actually, depolarizing axons that are coming from neurons in specific brain areas. But the brain areas that are targeted are fairly large, fairly wide. And so I think part of the challenge of these techniques is to, first of all, better understand how they work, but also to really improve the technology. So these things can be easier to apply and also kind of merge with this growing, I would say, need for wearables and wearable technology. So something like TMS might be a little more difficult to do by a patient by themselves. But other techniques, such as transcutaneous vagus nerve stimulation, there have been several devices that have been developed that you can literally go and buy and take home and functions almost as a wearable that you can, patients can treat themselves while at home. VNS, which is vagus nerve stimulation, is a technique by which almost like a pacemaker-like device gets implanted into the body, and then there's an electrode stemming from that battery power and coils around the vagus nerve in the neck, in the carotid sheath. Now, that was used for the treatment of epilepsy, and is FDA approved for treatment of epilepsy, and they just happened to find that epileptics that also suffered from depression, epileptics that also suffered from migraine, had showed improvement in those symptoms and those disorders as well. And so people became excited about that, and VNS has been applied for treatment-resistant moderate to severe depression. The problem, though, of course, is that it's an invasive technology, and there's a surgery involved. There's also issues of the fact that the vagus nerve in the carotid sheath is both afferent and efferent. That means that there's information that's carried from the viscera up to the brain. That's the afferent part. But there's also efferent fibers that are innervating the organs of the body. And so what you really want to do is pass information up into the brain, not do anything that changes your heart rate and that could have other sort of deleterious side effects. So the interesting part is that a branch of the vagus nerve actually exits out to the ear, and there's a specific portion of the ear called the sympaconcha, which is innervated by the vagus nerve. And it's sometimes called Arnold's nerve in neurology. And so people have developed technologies that are targeting this specific innervated part of the ear, and that's called TVNS, or transcutaneous vagus nerve stimulation. And there's a few devices that are sort of in the process of gaining FDA approval, and some of the targets for these devices include migraine. So, depression, of course, is a target, epilepsy, and migraine. And so we completed a study applying brain imaging in migraine patients to try to understand what parts of the brain are being stimulated by this technology. And we've also worked to try to optimize the technology by gating the stimulation to physiological rhythms, because we know that the target in the brainstem, in the medulla of the brainstem, is the nucleus tractus solitarius. And this little nucleus in the medulla of the brainstem also receives inhibitory inputs from respiratory neurons in the brainstem at specific portions of the respiratory cycle. So the interesting thing that we did is that we have gated the stimulation based on these respiratory rhythms. And we have a prototype. We're evaluating this with imaging studies, and hopefully this is something that can be developed more in the future. But whether it's respiratory gated or not, this is a very interesting technology, TVNS in general, and has been applied in several clinical trials, including recently for migraine, showing clinical benefit. I think a real key, as I said before, is really getting this towards the wearables kind of market. And I think you've seen pharmaceutical companies, more and more pharmaceutical companies get interested in this and looking at sort of almost like, parts of their company that are geared towards and based on neuromodulation to try to develop some of these things. And I think that's a really exciting development because I think it really puts a lot of resources towards the development of some of these new technologies. And so I think a real key issue that needs to be solved is power. Is, how do we get, if there's something that's wearable, how do we get enough power that people can wear that can provide enough oomph for stimulation to really do a clinically relevant job, but not have something that people have to, every hour go in and recharge. So I think battery power and incorporating this into wearables, I think, is a really key for the development of these technologies in the future. Absolutely. I think in general, I'm not sure that these technologies are quite ready to, and are not quite covered by insurance yet. So there is some coverage for TMS, I think, for depression, but most of these technologies are not quite ready for wide-scale commercial use. So I would just encourage people to keep their eyes out for some of these technologies, because as they go through the process of FDA and then, into insurance coverage, I think there will be some really interesting new advances coming. So keep your eyes peeled.